Good morning, everyone. I'm Dr. Joyati Shen. My name of my channel is eduhub.2m. Now I am going to discuss about the nocturnal dialysis, a new approach in renal therapy. Nocturnal dialysis is a form of hemodialysis performed while the patient sleeps, either in a specialized dialysis center or in the comfort of their own home. That means nocturnal dialysis occurs at night. The treatment schedule is 3 to 6 nights per week, for 6 to 8 hours each night, allowing the more gradual filtration. That means for this long hour period, the load on the kidney is much more less than the traditional dialysis. Available in specialist dialysis centers while with the overnight staff or as a home-based therapy with proper training. So it is much more easier to handle. And the main advantage is daytime freedom. Patients regain valuable daytime hours for work, education, family, and social activities. So, how the nocturnal dialysis works? It removes the waste products and excess fluid at a slower, more physiologic rate. Physiologic rate means if the normal kidney works properly, then whatever the time taken for the removal of the waste products and excess fluid, almost the same time is taken during the nocturnal dialysis. Now, allowing for more gentle fluid shift to reduce the treatment related symptoms. That means less problem of tachycardia, then bradycardia, or the blood pressure related problems, providing more thorough clearance of toxins due to extended treatment time. During the traditional dialysis, which for 3 to 4 hours, maybe some toxins are left in the body. But in nocturnal dialysis, there is enough time for the removal of almost all the toxins. And it also enables more balanced electrolyte and mineral management. Now, what is the clinical benefits or the health outcomes? Almost 64% reduced hospital days as the patient can accommodate in their own home also the nocturnal dialysis. Better BP control, as the research put forward that 30% of the BP is under controlled. Phosphate reduction is also 50% in nocturnal dialysis. Now, some additional clinical advantages: it improves the left ventricular mass index and cardiac function, as because less amount of stress is imparted on the cardiac function, so less ventricular mass index and the cardiac function. Reduced incidence and severity of sleep apnea. In other cases, due to pain and other symptoms, there may be some deficiency of the sleep. But in the nocturnal dialysis, as because it's extended for a long period of time, and the patient is also sleeps quietly while the dialysis is going on. Better anemia management with less erythropoietin means during the traditional dialysis, due to the load of the kidney, sometimes there are problems of the anemia, but in nocturnal dialysis, due to extended period of time, this problem is less. Improved nutritional status and appetite with the full stomach appetite, and whatever the food is taken during the night in the dinner, that is enough to continue for the whole night and the nocturnal dialysis. Better clearance of the middle molecules associated with uremic symptoms. That means due to extended time period, the clearance or the clearance through the glomerulus is much more thorough. It reduces the inflammation marker linked to the cardiovascular risk also. So overall, it has got a high beneficial outcome. It increases the quality of life. It increases the energy. Patients constantly report feeling more alert and energetic throughout the day with fewer dialysis hangover symptoms, because at the night they are going through the dialysis and also with a good sleep. Then dietary freedom, fewer restrictions on fluid intake, phosphorus and potassium rich foods, allowing more normal eating patterns. Reclaim time, daytime hours are free for them to do their normal lifestyle. Mental well-being. Studies show reduced rate of depression, anxiety, and improved cognitive function with nocturnal treatment. So there are different benefits which increases the quality of life, increased energy, enough daytime, mental well-being, and dietary freedom. Economic and health impact. It has been shown that rather than when compared with the conventional the hemodialysis, this nocturnal hemodialysis is much more pocket friendly. Now, technical and logistic requirements for this nocturnal dialysis. Now, facility requirement, specialized staffing for overnight shift. Definitely, there should be a specialized staff to look after the patient. Enhanced monitoring system for sleeping pattern. Then comfortable recycling chairs or beds for overnight treatment. So these facilities should be present for the nocturnal dialysis, which should give the patient a total comfort and relaxation. Home setup needs dedicated space for machine and water treatment system, means a separate room for this dialysis. If it is possible, then nocturnal dialysis is beneficial for the patient. Training requirements, 4 to 8 weeks of comprehensive patient and caregiver training, 24 by 7 technical support availability, regular home visit by specialized nurses, ongoing education and competency assessment. So these are the training that is required. A staff should visit regularly the patient to look after the problems, comforts, and discomforts during the nocturnal dialysis. Challenges and patient experiences. So in the left side, you can see that these are the experiences of the patient, and this is good. One patient is telling that switching to nocturnal dialysis gave me my life back. I can work full time again. That means it's also a mental relief. Another patient is saying in center nocturnal dialysis works better for me than home. So it is the experiences matters. Now, what are the common adaptation changes that should be taken? Initial difficulty sleeping while connected to the machine. It is a problem. Then psychological adjustment to the overnight treatment. Gradually it is overcome. Family disruption with home-based therapy. Learning curve for technical aspect of treatment, etc. This all subsides when there is a good sleep. Known risk and limitation. Number one is residual kidney function. Some studies suggest that aggressive dialysis may accelerate the decline of the remaining kidney function, though research remains mixed on the effect of the nocturnal schedules. So it has been seen by some research that residual kidney function, if with the traditional dialysis, then it declines gradually the kidney function due to forceful work by the kidney. Now, vascular access complication. Extended connection time may increase the risk of access-related issues, including infection, clotting, and needle dislodgement, as because the needle is fixed with the body for a long period of time, 6 to 8 hours during nocturnal dialysis. Now, equipment reliability. Extended runtime increases the importance of equipment reliability and proper maintenance with potential for technical failures during unattached hour, requiring backup systems. Next, patient selection consideration. Not all patients are candidates due to comorbidities, vascular access, etc. So these are the known risk and the limitation which should be kept in mind during the nocturnal dialysis. So what is the future of nocturnal dialysis? Growing adoption based on documented improvements in both clinical outcomes and quality of life. So it has been found that nocturnal dialysis definitely increases the quality of life. Next, research focused on optimizing treatment protocols and enhancing safety monitoring. Development of more compact, user-friendly machines designed specifically for home nocturnal use. That is very important. At home, the person can use the dialysis technique, nocturnal dialysis technique, at its own pace. Expanding telemedicine integration for remote monitoring and support. That's also a very important outcome of future outlook. Potential for wearable or implantable monitoring systems to enhance the safety. So nocturnal dialysis represents a significant advancement in renal replacement therapy, and it is loved by many of the patients worldwide. So do like, share and subscribe my channel to get the notification of the newly uploaded topics, recent topics on various subjects like dialysis, hemodialysis, then cardiology, nutrition, etc. Keep in touch. Thank you for your patient listening. Please do share this uh, uploaded video to your friends if they need that to increase their knowledge or to do good in the education. So keep in touch, subscribe my channel. Thank you.